You're watching Southern California's CBS 2. Now, CBS 2 News this morning.
Time now is 7:11. Laser technology has been used for treatment of gum disease for many years, but recently the FDA approved a new application called laser curettage. Our useful team health expert, Dr. Harlan Gibbs, is going to show you what the treatment involves.
The American Dental Association estimates that nearly 60% of the adult population in the United States has some type of gum disease, but only 3% of those affected actually seek dental care. This is probably because of the pain, bleeding, and postoperative discomfort associated with gum surgery. A new laser technology now allows patients to have the procedure with much less pain and much less bleeding, and promises to revolutionize the treatment of periodontal or gum disease.
Laser curettage is a procedure to clean out the gum pocket using laser light instead of conventional deep cleaning probes. The lifting of the ink off the card is very similar to the vaporization of the germs in the gum pocket. The laser targets only that tissue or bacteria which is pathologic. Gum disease involves bleeding, swelling, pain that can be associated with tooth brushing, loosening of the teeth, and eventually loss of the supporting bone structures that leads to loss of the tooth.
What are the advantages to the procedure?
Less bleeding, less pain, less swelling, less postoperative complications. We usually can measure this convalescent time in days versus weeks, or in some cases months. The cost is usually about the same, in some cases a little bit less. High tech is not always high cost.
And here's your U-Team prescription for health. If you have any of the signs or symptoms of gum disease, including swelling, bleeding, or if it feels like your teeth are pulling away from your gums, you should call your dentist immediately. With the new type of technology available, there's no excuse not to seek good dental care. I'm Dr. Harlan Gibbs, part of the useful team for CBS 2 News.
Thank you, Doctor. Laser curettage is widely available. If you suffer from gum disease, Dr. Harlan Gregg suggests checking with your dentist, as you heard, if you see qualify for that procedure. Yeah.
It is useful information.
This is ABC 7 Los Angeles. Now, Mark Brown, Michelle Tuzzi, Dallas Raines, and Rick Lozano with Eyewitness News at 4.
The idea of going to the dentist makes some people weak in the knees, and for the 60% of Americans who suffer from gum disease, going to the dentist can be painful. Health Check reporter Jessica Aguirre joins us now with the latest procedure that uses a laser. They're using lasers for everything now.
They really are, but this one's really going to save people a lot of pain. Now, gum disease sufferers often choose between traditional gum surgery, which involves actually cutting the gums away or sometimes losing their teeth. Now, a few years ago, the laser surgery appeared for this, but now dentists right here in the Southland are using a new method which actually vaporizes only the diseased part of the gum. And best of all, it's pain-free.
Gum surgery. Say the words and you think of debilitating pain and weeks of discomfort. That was Cameron Inda's experience.
2 weeks, it was excruciating agony. I had come out of the procedure with 3 or 4 teeth pulled, so I no longer had any of these teeth on this side of my face.
Inda never had her surgery finished, and her gum disease got worse again. This time she found Cerritos dentist Robert Gregg. He's patented a new laser procedure that made all the difference.
It took me at least 2 weeks to even go back to work with the first type of surgery. I was going to work on a regular basis with the other surgery. I never even went home to rest.
The new procedure uses a laser to remove the disease. There's no cutting, no stitches, no waiting for the gums to reattach to the teeth.
You're going in with a little fiber optic, which is like the width of 3 hairs, into the pocket around the tooth, allowing that actual 2 different wavelengths to take place and have an effect on the epithelial line or the actual tissue lining, removing selectively only the bacteria and the germs which cause gum disease.
Patients undergoing the laser procedure get Novocaine, not the heavy anesthesia needed for regular gum surgery. And that means they can get back to normal life right away.
And a lot of them are out like shopping or golfing or surfing, and after treatment that day.
One of the biggest benefits of this new aggressive laser gum surgery is that in many patients it promotes regrowth of the bone that's been lost to gum disease.
Now, doctors using this procedure report that more than 80% of patients stay disease-free for 5 or more years. Symptoms of gum disease include gums that are red, swollen, tender, or that bleed easily, also loose teeth, and also a change in your bite. If you want more information on the fiber optic gum laser surgery, you can call the Health Check hotline at 213-520-ABC7. See? No fear involved. Don't have to be scared anymore.
And it doesn't involve a drill, which is a good thing. Thank you, Jessica.
News that hits home every day. This is 10 News at 5.
And coming up in our Staying Healthy report, going to the dentist could soon be pain-free thanks to a brand new laser surgery.
A lot of people are walking around with gum disease, but they are absolutely terrified of the treatment. Carol is joining us now with tonight's Staying Healthy report to show us why that could be maybe a thing of the past.
Yeah, they've taken some polls, Steve, and found that 3 out of 4 Americans have gum disease. 97% do not get help. Why? Well, who wants painful gum surgery? That's why 2 Los Angeles dentists are making the decision for surgery much easier.
Watch how she brushes, and it's obvious Janice Moore cares about her teeth. Yet she was willing to risk losing them to gum disease if this was her only option. The cutting, stitches, bleeding, and pain of gum surgery scared her off.
My friend told me if I ever have to have my gums cut, don't do it. Have your teeth pulled before you have it done, because she was in agony.
Fortunately for Janice, there was one more option. Dr. Robert Gregg's new painless laser procedure. With this tiny wand, Gregg and partner Dr. Delwyn McCarthy need no scalpel or stitches. The laser moves along the gum line, destroying only diseased tissue, leaving healthy tissue in place. These dentists say not only is it fast and painless, but for the first time ever, they're seeing the damage reversed.
Conventional thinking says that once you've lost the bone, it never comes back. We're actually seeing bony regeneration, which prior to the laser and this technique, been unheard of.
Gregg says it lasts longer, too. Traditional surgery usually has to be redone within 5 years if the infection returns. He says the majority of his patients won't need a second treatment.
My teeth don't bleed when I brush them, and they're pretty tight in my mouth. They're not loose.
Janice is thrilled with her results and insists a trip to the dentist doesn't have to be a pain.
I think it's a breakthrough in dentistry, and I don't think people should be afraid to go to the dentist and have this done.
The laser treatment costs anywhere from $4,000 to $6,000, but Dr. Gregg says most insurance plans do cover it. To find out if a dentist in our area does the procedure, just call this number, 888-49-LASER. Steve, back to you.
Thank you, Carol.
Health story for everyone here. 60% of American adults have gum disease. The American Dental Association says most people would rather risk losing a tooth than get gum surgery. But as health specialist Denise Dodor reports, a new FDA-cleared laser alternative may get more people into the dentist chair.
How are you doing, Linda? You feeling anything?
Good. Today, Linda Drexler is doing great. Yes, she has gum disease, but at least she doesn't have to go under the knife. She's taking advantage of a newly approved laser, which means no cutting, no stitches, and hardly any downtime.
So the patient is back to their daily routine, back to work right away. They can come in on their lunch hour and resume their daily activities.
Gum disease is when the gum and bone erode and teeth become loose in their sockets.
I was losing bone, and I did not know that either because of this gum disease.
Lynette Little is one of 100 million Americans who has gum disease. Symptoms include bad breath, red or swollen gums, bleeding when flossing or brushing, and a change in the way your teeth fit together. Left untreated, the bacteria in the mouth can travel through the bloodstream and cause heart attack and stroke. It's even linked to premature deliveries. Each year, 30,000 of us undergo painful gum amputations to treat it. But now many dentists are offering laser periodontal therapy.
This procedure does for dentistry what LASIK has done for people with eye problems.
Periolase selectively destroys diseased tissue and heals as it treats. Dentists say it also helps promote bone growth. The best part for patients is the ease and convenience.
In the new way, you can walk out the door and it's like you just came to the dentist's office for a checkup. I mean, it was just such a breeze.
And with this new laser treatment, it's less likely that a reinfection will occur. In Sherman Oaks, Denise Tudor, ABC 7 Eyewitness News.
A Texas man had an extra special Father's Day.
This is ABC 7 News at 6.
About 80% of us have some form of gum disease, and despite the risk of losing teeth because of it, many people avoid going to the dentist. But now there is a pain-free way to treat the problem. ABC 7's Dr. Dina Dell reports in tonight's Medical Journal.
Wonderful. Like many people, Arlene Carter didn't even know she had a major symptom of gum disease.
I kind of felt that one of my teeth were loose.
She was shocked when she got the diagnosis and knew she had to get the problem fixed quickly.
Of course, brushing and flossing can prevent gum disease, but if you get it, it A, is a major cause of tooth loss, and B, it needs to be treated. But traditional treatments can be painful, usually involving a scalpel and stitches, and even pain. Well, now there is an alternative.
Her dentist used a new procedure to treat her disabled gums. It's called Laser-Assisted New Attachment Procedure, or LANAP.
LANAP is a method to gently pass between the gum and the tooth to vaporize and remove only the diseased tissue.
Traditional treatments for gum disease can be painful, usually involving a scalpel and stitches or scraping the gums. But the laser method promises patients a pain-free way to zap away the disease.
They don't hear it, they don't feel it. If they were to feel anything, they might feel a little warmth.
First, a laser uses heat to strip away the diseased gum. The laser only seeks out infected tissue, which is a darker color than healthy tissue. Then the dentist uses a laser a second time to heat the area until a clot is formed, protecting the newly lasered tissue by keeping it closed.
One of the nice things about this technique is we're only treating the patient once.
For most patients, the laser treatment also means fewer follow-up visits and less time in the dentist chair. Arlene couldn't be happier with her results.
The healing was much faster. There was no soreness in my gums whatsoever.
I'm Dr. Dina Dell.
All you need is a local anesthetic to numb your gums. The typical laser treatment takes about 2 hours. For more on this new approach to treating gum disease, log on to abc7news.com and click on Dr. Dina Dell.